Welcome to Halteres Presents, a brand-agnostic interview podcast that seeks to objectively highlight the happenings within the world of diagnostics. And now, your hosts, Rich Thayer and Mickey Urdea.
Welcome to Halteres Presents. I'm Rich Thayer, Managing Partner at Halteres Associates.
And this is Mickey Urdea, Founding Partner at Halteres Associates. Today we talk with Dr. Tom Baer from Exact Sciences. He gave us a wonderful conversation on a number of different areas. Firstly, how it is that Cologuard, the famous test from Exact Sciences for colorectal cancer screening, impacted the way that they're approaching MCED. And he had great insights on that. We also talked to him quite a bit about the complementarity between existing tests and the MCED tests. And he had some great points to make about it, and I think you'll find it very compelling.
And now, our interview with Dr. Tom Baer.
Welcome to Halteres Presents, and we're so pleased to have you here today as our guest. Just to get us started, would you please tell listeners a bit about yourself and your previous work and your work at Exact Sciences?
Great to be here, and thanks for the opportunity. So first of all, I'm a medical oncologist. I continue to see patients on Friday mornings in clinic, so I'm a real doc and have been for a long time. My clinical practice focuses on the care of men with prostate cancer, and that was my life's work up until about 8 years ago when I got involved in cancer early detection, had a chance to work for about 5 years providing medical leadership to a Center for Early Detection at the Oregon Health and Science University Knight Cancer Institute, where we were working to develop cancer screening tests and really got exposed to this exciting new field and recognized the power of emerging technologies to make an enormous impact potentially on human health by detecting many cancers earlier. And so about 3.5 years ago, I heard from Exact Sciences. They were looking for a chief medical officer for their multi-cancer early detection program. And I jumped at the chance to work on that, and I've been working for a little over 3 years now with a team to develop what's become the Cologuard test, a blood test designed to detect many different types of cancer earlier. So really happy to be here with you to talk about that.
Dr. Baer, thank you. It sounds like you have a wonderful experience set to be supporting these MCDE programs. Starting with what became Cologuard, Exact Sciences has been a pioneer in developing early detection tests for cancer. What's even more fascinating is that Exact Sciences has created the market for Cologuard by educating the consumer. That's a very rare set of circumstances for diagnostic companies in our experience. It's more like a large pharmaceutical company undertaking for market development. What have been some of the lessons learned that impacted the approach to the Cologuard MCED test work?
Yeah, thanks for that question. So I do think that working on multi-cancer early detection at a company that has this storied history with Cologuard has been a tremendous advantage for me and for the program, and I think for patients. And the work on Cologuard really began as early as 2009, was the vision of Dr. David Ahlquist at the Mayo Clinic, combined then with the commercial skills of a nascent company called Exact Sciences that's now grown to nearly 7,000 employees and delivered the Cologuard test to more than 20 million people. So it's been a tremendous story. And one of the innovations that you alluded to in your question is the commitment to educating people about colorectal cancer screening and its importance as part of the Cologuard story. And I think that's likely why Cologuard's been responsible for the large majority of the increase in colorectal cancer screening adherence in the United States. When you look back, almost 3/4 of the increase in colorectal cancer screening adherence can be attributed to the Cologuard test and all the outreach that Exact Sciences has done to make the public aware of the importance of screening. And it doesn't just stop at awareness, but it also includes considerable support for patients and healthcare providers in their screening journey, helping folks know what they need to do, how they need to do it, seeing them through to completion of the test, and if necessary, completion of the colonoscopy that needs to follow a positive test result from Cologuard. Exact Sciences does all that extremely well. And that experience is critical to the success of the CancerGuard test. It's such a new technology. People are not today familiar with the concept of using a blood test to detect many different cancers at the same time. So that tool chest, if you will, or that skill set that Exact Sciences brings to bear in educating the public about the need for cancer screening, the opportunity to screen for many more cancers that currently go undetected, and then educating folks about the follow-through after a test. We're going to bring that all to bear in support of the CancerGuard test, and it's a tremendous opportunity. If you think about the fact that today we screen for 4 common cancers, 5 if you include prostate cancer, and that means that about 70% of cancer diagnoses and about 70% of cancer deaths are due to cancers that we don't screen for at all. These are cancers that essentially sneak up on us, and we find them often because there are symptoms due to an advanced cancer, and sometimes because they're incidentally found on an unrelated X-ray or CAT scan that somebody might get for another reason. But tests like CancerGuard are really aiming to change that and make screening available for much of the cancer burden that we all face today.
Out of curiosity, do people that get the Cologuard test also follow up with their physicians for the colonoscopy regularly?
Yeah, that's a critical component. So, the large majority of individuals who get a Cologuard test receive a reassuring or a negative result. And of course, those individuals, they need to get tested again 3 years later and continue with a screening program. Remember, cancer screening is not just a test, it's a whole program over a lifetime and all the necessary follow-up. But in the event that the Cologuard test returns a positive result or a result that suggests that a cancer may be present, then those individuals need to get a colonoscopy to get that checked out. And oftentimes that's a different healthcare provider or physician. The Cologuard test is typically ordered by the primary care doc, and colonoscopies are done by gastroenterologists. So that process involves a referral to a gastroenterology clinic for the colonoscopy. And here, those are well-worn pathways. Clinicians are well aware of that and know how to do that, and typically have those relationships in their medical community. But at Exact Sciences, we're also increasingly engaging in reminding patients and making sure that patients have the support they need to follow through. The benefits of screening come from cancer detection and the necessary follow-up. So you have to not just take the screening test like Cologuard, but if it's positive, follow through. It's really critically important.
Right. And of course, similarly, MCED is follow-up usually with imaging, and you'll have to go through the same sort of education process there.
Yeah, absolutely. And that's going to be a challenge that we're really up for at Exact Sciences, with all the experience that we've gained from 11 years almost of Cologuard. But it is a brand new technology. It is not familiar to everybody, and so we really look forward to helping folks through that journey through the CancerGuard test in the event that it returns a positive result. So first of all, we have a commitment to support the prescribing healthcare providers with information, because it's a new test and people are going to be learning what to do. This isn't like Cologuard, where pretty much everyone on the planet who has been involved knows what to do if a test comes back positive. We really need to get the information out there. And so we've prepared a lot of materials for prescribers that guide them through the next steps in the diagnostic pathway. We've designed a diagnostic pathway that's really, really straightforward. and it's easy to implement. It starts with a clinical visit, a checkup with a healthcare provider, some routine labs, and then goes on to imaging, starting with a CT scan, and if necessary, a PET scan. And it can be done the same way every time. So people will know what to do once they get used to it. We will be reaching out to prescribers with a phone call or some other form of outreach every time one of their patients has a positive test, and just checking in to see that they've got the information on hand, they're comfortable with their next steps, they don't have any questions for our medical teams, or they don't need some additional materials or information, a diagnostic guidebook or anything of that nature. We will stop calling them when they tell us to stop, of course. But initially, we do anticipate supporting the healthcare providers through that journey. Patients will have access to a third-party patient navigation service where they can call and ask a question, have the test results explained or clarified. Of course, the primary source of information will be their healthcare provider, but this is an additional resource that they can access directly in the event that they need assistance finding a healthcare provider or finding an imaging facility or a lab facility. That patient navigation service will help them through that all the way through to the completion of the workup. And another piece that we're really excited about is the imaging reimbursement program. Because this is a really new test, we know that patients are worried about whether their health insurance will cover the costs of the imaging they might need in the event of positive test results. And we think most of the time health insurance will provide coverage for those tests. But in the event that someone's insurance is not agreed to cover those tests, there's a reimbursement program for up to $6,000 of out-of-pocket costs related to the imaging needed to work up a positive Cologuard test result. So we've designed that to give people some measure of peace of mind going into the testing, that we have their back in the event that they need imaging and their insurance turns them down for coverage for that imaging.
That's phenomenal. Wow.
Yeah, I think you have to make those kinds of innovative steps when you bring a brand new technology to market that the health system and patients and providers aren't quite used to yet. We think in a year or two, when this becomes more commonplace, this might be less of an issue. But straight out of the gate, we really wanted to cover all the bases.
And again, the fact that you established that substantial market with Cologuard, you can't afford it as opposed to most startups. They're just not going to go down that path. It's not possible.
The Cologuard test has a very high, what we call specificity, meaning that the risk of false positive results is quite low. And so, the vast majority of patients will receive a negative result, and this need for imaging is only going to be an issue for 1 or 2% of patients, more than likely. So that's another feature that helps make that kind of support affordable.
That's what we've seen so many companies that have these ridiculous specificities that are going to just create so many extra costs for the workup of the false positives. Just crazy. So, we share your enthusiasm for that.
Yeah, I think it's very important for us to think about it, and we've really sought to balance the sensitivity and the specificity optimally to capture as much benefit with an acceptable level of false positive risk.
So it's quite interesting that the Cologuard biomarker panel uses both nucleic acids and proteins. And of course, Cologuard uses both marker types as well. That's rather different from a lot of others who are looking at MCED tests. For instance, many of them just use methylated DNA. How did this approach at Exact come about?
This idea of multiple biomarker classes has been at the core of this concept ever since the concept was first conceived of in the laboratories of Johns Hopkins University, where Bert Vogelstein and their team came up with this concept and really thought that the two biomarker classes would offer complementary information. And they designed a precursor to the current test. Back then it was called CancerSeq. And in studying CancerSeq, they did indeed demonstrate that interrogating the DNA and proteins provides complementary information. And so we've really remained committed to this approach of looking at different biomarker classes and believing that ultimately that will give us the most shots on goal to detect cancers, and that ultimately we're likely to find that some cancers are easier to detect through proteins, others through DNA analysis, some maybe through both. And we've persisted in this approach, and we're very happy with this approach of using multiple biomarker classes. And as you pointed out, it's the only multi-cancer early detection test on the market to interrogate multiple biomarker classes at the same time.
Yeah, I had some early experiences with using multiple biomarker types, and I wasn't so lucky because we're using lipids and proteins. And we, at the end of the day, found they could replace each other, but they didn't complement each other. So our AUC didn't improve. But obviously, that's something that panned out perfectly for you. That's really interesting.
Yeah, there's certainly an art and a science to combining different biomarker classes together and designing the analytic algorithms that serve to extract as much information out of the sample as possible to detect as many cancers as early as possible.
Yeah, it's not easy. It seems that most people that are working in this field believe that MCED is most important for finding early stage cancer. But from what we hear from others, including yourself, it's not necessarily the most impactful attribute of a test. How has Exact Sciences thought about the goals and necessary performance for Cologuard to best address the unmet market needs here?
You know, there are multiple objectives when you design a test like this, and certainly detecting as many cancers as we can as early as possible when treatments can be more effective and cause fewer adverse effects related to the treatment is a fundamental objective of these tests. At the same time, it's not just about the earliest stages, it's also about shifting the diagnoses from the more advanced stages to the earlier stages. And when we've looked at the expected impact of Cologuard on cancer burden, we developed a mathematical model of essentially cancer burden in the United States at a population level that accounts for the health outcomes we expect in our population, that accounts for taking advantage of available cancer screening tests as we do today, and then ask the question, what would the addition of a test like Cologuard produce? And what we found in looking at the simulation model and the use of Cologuard for a decade is a large reduction in the burden of stage 4, the most advanced stage of metastatic cancer, about a 42% reduction in stage 4 cancer that we would expect to see in a community of individuals who add Cologuard to their usual screening tests that they continue at usual rates. And there's a corresponding modest increase in stage 3, stage 2, and stage 1 disease. So you see sort of a shift in the cancer burden to earlier stages. And when we look at the predicted cancer mortality by stage using current available data, what we see is that a reduction in stage 4 disease of that magnitude would be expected to produce about an 18% reduction in all cancer mortality in that population. That is a very large impact from a single intervention. In fact, as an oncologist, I can't think of any single cancer-directed intervention that can reduce cancer mortality across the entirety of our cancer burden by something like 18%. So yes, we want to detect cancers as early as possible, and we've worked hard to boost the early stage sensitivity of our test, but we can also achieve significant impacts by shifting the stages earlier, and not every one of those diagnoses will be at stage 1 or 2, some will be at stage 3, but outcomes even at stage 3 are often better than at the most advanced stages. And so in aggregate, we see a significant benefit at a population level to a test like Cologuard.
Is it appropriate to think in terms of something like in stage 4, early detection of stage 4 does permit you to get into the treatment stage earlier than may be otherwise possible?
Yeah, I think the point that you're making, that earlier is often better, even within a stage, is a really good point. And that gets really deep into the nuances of these analyses, where even if you detect a cancer at stage 3, for example, we know from lung cancer that stage 3A has different outcomes than stage 3B. So there are opportunities to shift the diagnosis earlier, even within a stage. Ideally, we would like to get out of stage 4. Stage 4 for many cancers is a situation where a cure is difficult to find, not impossible anymore, thanks to some of the advances in cancer treatment that we've seen in the last couple of decades, but still less common. But to your point, absolutely, the earlier the better, even within a given stage.
Dr. Baer, what have been the major clinical trials that Exact Sciences has conducted for Cologuard, and what were the major observations?
Sure. So I'd like to talk about 3 different studies here. First, ASCEND-2, which is the fundamental basis for the Cologuard product that we've recently launched. ASCEND-2 is a case control study where we collected samples from patients with a recently diagnosed cancer or immediately prior to a cancer diagnosis. We collected a broad range of cancers and samples from all 4 stages of each cancer type to really get at test performance as well as we could. We also collected control samples from individuals without a suspicion of cancer. And that enabled us to estimate things like test sensitivity and specificity and so on and so forth. And with a focus on sensitivity, sensitivity, of course, is the ability to detect a cancer that's present. And when we look at all cancers excluding breast and prostate, the sensitivity across all cancers in all stages was 64.1%. When we looked at the most aggressive cancers, the 6 cancers with the shortest 5-year survival in the United States, and that includes cancers like pancreatic and ovarian, as well as lung, gastric, esophageal, and liver, the sensitivity was 67.8%. When we looked across a broad range of cancers, again, excluding breast and prostate, by stage, we saw at 24.8% sensitivity for stage 1 cancer, a 39% sensitivity for stage 1 or 2 cancer, about a 58% sensitivity for stage 2 cancers. So really rewarding levels of sensitivity for a blood test like this that's designed to detect many different cancers with a high specificity. A note of caution, of course, case control sensitivities may not reflect the sensitivity in the screening setting. We do expect sensitivities to be somewhat lower in the screening setting. And the study that's going to reveal those numbers to us is called the Falcon Real World Registry, where we're enrolling up to 25,000 individuals in a real world setting and offering them access to Cologuard on an annual basis for 3 years in a row, and following those patients for several years beyond that testing period. And we're going to learn a whole lot about not just how the test performs, but how people feel about the testing experience, how the diagnostic evaluation goes in the real world, and so on and so forth. That study's ongoing. And finally, I wanted to highlight an earlier study called DETECT-A that was completed by 2019, published in 2020. It looked at an earlier version of the test called CancerSeek. But the beauty of that study is that we now have almost 5 years of follow-up. And so we're able to really learn about the long-term potential of this kind of testing. And in the DETECT-A study, 10,000 participants had the CancerSeek test on one occasion only. That was an academic study with philanthropic funding. They didn't have the resources to test patients for multiple years. But even that one instance of an MCED test was able to detect as many cancers in that group of participants as all standard of care screening tests combined. And MCED detected cancers were found in 26 individuals. And with long-term follow-up, we know that a full half of those individuals are living free of cancer 4.5 years later on average. Were successfully treated into complete remission and have a durable remission more than 4 years out. So those kinds of data put a lot of wind in my sails to be working in this field, seeing what's possible with this kind of cancer screening. So those three studies, Ascend-2, Falcon, and Detect-A, serve as the core fundamental data that support the CancerGuard test.
That's spectacular.
Wow, very good reason to be pleased. That's just incredible results.
Thank you very much.
And the new one, the CancerGuard, is an improvement over CancerSeek.
Yeah, it is. I mean, we've obviously we've not compared the two tests head to head in the same samples, but we believe it's an evolution towards improvement of the test, and that's what we've been working hard on. Yes.
This episode of Halteres Presents is brought to you by the UC San Diego Extended Studies In Vitro Diagnostics Product Development course. Are you looking to take your biotech career to the next level? The UC San Diego Extended Studies In Vitro Diagnostics Product Development course is a unique, live online program designed for managers, entrepreneurs, investors, and scientists. This team talk course by award-winning industry experts covers everything there is to know about the requirements for moving an IVD product from concept to regulatory approval and market launch. Explore real-world product development cases to help you plan for success by covering topics such as setting product requirements and specifications to meet customer needs, critical path management, resource planning, principles of assay development, instrumentation, role and composition of the product development team, risk analysis, and IVD clinical and regulatory issues such as compliance and complaint handling. Ready to get started? Enroll today and use our exclusive discount code to get a 10% discount on your enrollment. Use code HALTERES10 at checkout. That's HALTERES 10 for 10% off the price of your UC San Diego Extended Studies In Vitro Diagnostics Product Development course. Just check the link in the show notes for this episode and use code HALTERES10 to enroll today. Accelerate your in vitro diagnostics career with the UC San Diego Extended Studies program. Your future in biotech starts here.
So coming back to the first question again, concerning the consumer education efforts spearheaded by Exact Sciences for Cologuard, what has changed since then? And what are you looking to incorporate now in your new consumer-facing programs?
Yeah, so I think that the consumer awareness programs for the Cologuard test have really transformed colorectal cancer screening and the place of the Cologuard test in the mind of the public and of the healthcare providers. Right now, aided awareness for the Cologuard test is at 95%. Top of mind awareness of Cologuard is above that of colonoscopy. That's an incredible accomplishment for our team that has driven the outreach to consumers. It is clear now that we are a leading voice in cancer screening in the public's mind. That has translated into tremendous progress in driving adherence to colorectal cancer screening. So colorectal cancer screening improvements have been attributed largely to Cologuard. A recent study suggested that 73% of the increase in colorectal cancer adherence in recent years is directly linked to the Cologuard test and the awareness that's driven. And then in recent times, we've launched campaigns that are squarely aimed at Hispanic audiences, as well as individuals who get their care through federally qualified health centers. And we're seeing growth in awareness and acceptance of our colorectal cancer screening in those settings as well. That loyalty and awareness doesn't just translate into the initial uptake of the Cologuard test, but also in long-term loyalty to the test. When we look at adherence or test completion at rescreen, it is 80% and above for individuals who are doing the test for the second time and approaches 90% for the third time. So we're really forming bonds with our patients through those awareness campaigns and the experience that they have with Cologuard that are long lasting. And remember, to be truly successful, cancer screening is a lifetime commitment and a program. It's not a single test. So when you think about the fact that folks that engage with Cologuard not only are now aware of Cologuard as a recommended screening options, but that commitment and that awareness grows over time as they engage the second time and the third time in that every 3-year screening experience with Cologuard.
You know, as unpleasant as this topic is, there seems to be a general awareness in the population about the importance of screening for colorectal cancer, and if caught early, can be pretty successfully treated. Do you expect that same level of awareness to be, readily departed to the population about the need to do multi-cancer screening, multi-cancer early detection, or are there some new approaches or efforts that Exact Scientists believe they should be taking?
Let's start with colorectal cancer screening first, because I completely agree with you that there's a broad awareness of the importance of it. But I do want to make the point that colorectal cancer screening is a bit unique in that it is not just about catching cancer early so that it can be successfully treated, which it is, but it's also about catching precancerous lesions that can lead to the development of cancer. And so successful colorectal cancer screening involves early detection of both cancer and advanced precancerous lesions, intervention to remove those lesions, and translates into potentially preventing colorectal cancer. So it's really folks really need to be aware of colorectal cancer screening because it can make a tremendous difference. And it's not just catching cancer, but it's also preventing cancer.
That's well stated.
Multi-cancer early detection with tests like CancerGuard is a brand new field. And I think we're going to have to do the work that was done with Cologuard all over again. The beauty of our position at Exact Sciences is that we know how to reach people about cancer screening. And so I would expect for us to deploy all that experience from engaging consumers with humor, or with memorable campaigns, to engaging folks directly through our patient navigation programs and so on and so forth, to build awareness and build support for test completion and for completion of the necessary workup in those individuals who need that. So remember, it took a decade to get to where we are with Cologuard, and the work continues for Cologuard. So I don't expect that we will achieve a similar level of awareness overnight. But when I look over the 10-year horizon, I'm convinced that we will get to a place where screening for most cancers with a test like CancerGuard is going to become a routine part of our healthcare maintenance. And we will look back on 2025 and wonder, how is it possible that we essentially let 3/4 of cancers sneak up on us undetected and didn't look for them? I very much believe that there will be a point of inflection where, just like today, when I explained to my young adult kids what the world was like without an iPhone and even without the internet, 10 years from now, we'll look back and people will wonder, what was the world like without multi-cancer early detection, and how could it be that we didn't do that? So we've got our work cut out for us today. I'm firmly convinced that we'll get to a place where everyone will be aware of this.
You bring up humor, and obviously the first thing that comes to my mind is Woody Harrelson and Saturday Night Live sketch. How did people at the Exact Sciences think about that? Just curious.
Oh, so I'm told, and I believe it's true, that we had absolutely nothing to do with that. It just happened. And I can tell you, when you make Saturday Night Live, you've made it big. I mean, that is that means you're part of the cultural conversation of this country. So it was a tremendous moment. And I don't have the stats at my fingertips, but I'm pretty sure it broke all records in terms of folks going to our website, learning about colorectal cancer screening, and so on and so forth. So we were just thrilled to see Woody Harrelson and Keenan Thompson and the team at the SNL show take on Cologuard. I'm not sure we can be so lucky with CancerGuard, but that would be the day.
It would.
Well, we share your vision of the future and hope indeed over the next 10 years, CancerGuard becomes that well adopted. In your opinion, what needs to happen for MCED tests to become more broadly adopted, perhaps even mainstays in medical practice, either now as LDTs or lab developed tests, or in the future once they've been FDA approved? You mentioned the patient navigation service that you offer, but is there a need for other new types of experts, perhaps along the lines of genetic counselors, to aid in this whole patient pathway process, or other issues that you think could very much help with the education, awareness, and importantly, adoption of this testing?
I think the implementation of these tests in health systems and clinical practices is going to vary. And I already see at many centers around the country clinics emerging that are dedicated to the evaluation of patients who had a positive multi-cancer early detection test. There's a lot of interest, particularly at larger academic health centers, in providing that sort of a service. And around that service, you can see the emergence of research programs on cancer screening and academic thought going into how do we detect more cancers earlier. MCED tests are part of that solution, but there are other, there are single cancer screening tests like the Cologuard test and others. There are emerging programs for screening individuals that have uniquely elevated risk with a specialized strategy. So I think we're going to see more dedicated clinics where clinicians, sometimes oncologists, sometimes primary care providers, bring together teams around the opportunity with these emerging cancer screening technologies. I also think many of the processes involved will happen in primary care practices, just like we see with the Cologuard test. And that's one of the reasons that we've designed a streamlined, straightforward diagnostic strategy for the CancerGuard test, so that busy clinicians who are seeing lots of folks in their practice can easily implement a diagnostic evaluation for a patient whose CancerGuard test is signaling a suspicion of cancer. So I think there's more than one solution to this. I think we'll see many primary care providers engaging with these tests, and over time getting comfortable, getting used to these diagnostic processes, and we're there to help. But I also see the emergence of specialized clinics where patients who access these tests through non-traditional channels, or busy clinicians who'd like a hand evaluating their patients, will be able to refer a patient for a diagnostic evaluation for a positive test result.
Thank you. That sounds well thought through.
In the future, as the MCED tests are more accepted, what's going to happen with our existing screening tests for individual cancers, mammography, and your own Cologuard? Are those going to go away, or are they complementary to MCED?
Yeah, thank you for that question. That's a really important point. And the short answer is they'll be complementary, but let me tell you why that's so important. There are some physical limitations to blood as a medium for detection of cancers. So if you look, for example, at what a stool-based test like Cologuard can do compared to a blood test, the sensitivity for early stage colorectal cancer is inevitably higher. And not only that, but the Cologuard test can detect precancer. Now, precancer is a critical component in colorectal cancer screening that enables potentially the prevention of the development of colorectal cancer by intercepting those precancerous polyps. they really don't secrete almost anything into the bloodstream. And so the ability of blood tests, be it multi-cancer tests or dedicated colorectal cancer tests to detect precancer is very, very low, and not anywhere close to what can be done through stool. And it just makes sense. The stool is the fluid that is directly exposed to those colorectal cancer secretions. With breast cancer, small breast cancers just don't secrete very much DNA into the bloodstream. They're hard to detect through blood. So mammography is going to be a mainstay of breast cancer screening, regardless of these blood tests. Cervical cancer screening, we look for HPV virus and we do pap smears. Those detect very early stage cervical cancers. That cervical cancer screening has been one of the biggest public health successes, with mortality from cervical cancer down dramatically from where it was 50 years ago before the pap smear was invented. There is no way that blood tests can compete in that setting. So I really see the proven single cancer screening tests and multi-cancer early detection tests coexisting. At the same time, it would be impractical to try to develop single cancer screening tests for all those other cancers that multi-cancer tests cover. Collectively, they represent about 70% of cancer diagnoses and deaths. But that 70% is composed of many, many cancers. Individually, these are uncommon. And so to try to detect those one cancer at a time would require us to create tests whose performance would be very hard to achieve, would require studies of hundreds and hundreds of thousands of individuals that are really not feasible to carry out. And even if we were able to overcome those probably unovercomable challenges, you'd create a world where you'd have 20 or 30 different cancer screening tests, and we would be asking you every couple of weeks to go get your next cancer screening test. That's really not going to work. And that's why we think multi-cancer strategies are the best answer to complement the available screening tests for single cancers that by and large are for the most common cancers, with a blood-based test that expands the reach of screening to many more cancer types. So they will coexist and complement one another rather than compete.
That makes a lot of sense.
So Dr. Baer, thank you. It's been a pleasure speaking with you today.
Yes, thank you very much. I think our audience is going to enjoy this conversation.
Thanks very much for the opportunity. It was really great to talk to you.
Halteres Presents is produced by Halteres Associates, a US-based bioscience consultancy that provides strategic and tactical services in the areas of diagnostics, medical devices, and life science research to clients of all sizes. The views, information, or opinions expressed during the episode are solely those of the individuals involved, and Halteres Associates is not responsible for any errors or omissions or for the results obtained from the use of this information. The information provided in this episode is for informational or educational purposes only and is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Halteres Associates would like to say thank you to this episode's guest or guests, and thank you for listening to this episode of Halteres Presents.